Call this Board of Supervisors meeting of April 9, 2020 to order. Roll call, please.
Supervisor Bronson?
Here.
Supervisor Christie?
Here.
Supervisor Miller?
Here.
Supervisor Villegas? Here. Chair Valadez?
Present. Let the record show all members are present. We'll go ahead and do our moment of silence, and I'll take a point of personal privilege. The founder and longtime director of the Community Food Bank of Southern Arizona, Punch Wood, passed away yesterday. And while he no longer lived here, his roots were very, very deep in our community. So I ask that you keep he and his family in your minds and your thoughts and prayers. And then the Pledge of Allegiance will be given by Supervisor Bronson today. Please stand. Supervisor Bronson. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Chairman,
Supervisor Christie.
point of personal privilege just to again notify you and the clerk of the board that when the board meets agenda item number 8, I will be recusing myself.
Thank you, Supervisor Christie. We'll keep that, make a note of it, and make sure that we follow that. I'm going to go ahead and read a statement into the record just to make sure that we're covered. Due to the existence and rapidly evolving nature of the COVID-19 emergency, it is not always possible to provide the necessary 24-hour notice for items to be discussed through Pima County, though Pima County has made all reasonable efforts to do so. Item number 1 on the addendum was submitted to the clerk of the board at the earliest practical time and should be decided without delay. Therefore, discussion, consideration, and action on that item may occur with less than 24-hour notice, as this it is an emergency item. And I wanted to enter that into the record as well. All right, well, we've got a little bit of good news to do. Supervisor Villegas, if you could join me in front of the podium, in front of the dais. Should pick you up there. Okay. All right. Please follow along here and just repeat as I do. I say your name, do solemnly swear and affirm.
I, Betty Villegas, do solemnly swear and affirm
that I will support the Constitution of the United States.
that I will
support
the
Constitution of the United States.
The Constitution of the United States.
And the Constitution and laws of the state of Arizona.
And the Constitution and laws of the state of Arizona.
That I will bear true faith and allegiance.
That I will bear true faith and allegiance.
To the same.
To the same.
And defend them against all enemies.
And defend them against all enemies.
Foreign and domestic.
Foreign and domestic.
And that I will faithfully and impartially.
I will faithfully and impartially
discharge the duties of the Office of Board of Supervisors, District 5.
The Office of Board of Supervisors, District 5.
According to the best of my ability.
According to the best of my ability.
So help me God.
So help me God.
Congratulations.
Thank you. Thank you.
Congratulations, Supervisor Villegas. Board of Supervisors, boards, commissions, and committees. This was put on by District 4, Supervisor Christie.
Thank you, Mr. Chairman. I think at this particular time, we do have 2 boards or commissions already operating, at least 2, Planning and Zoning and Health, and there may be a third. They're researching that, but those 2 are up and running. I think it's very essential at this particular point with this countywide emergency that we reactivate at least 3 commissions that have been closed due to the emergency. I feel they are essential and vital to the community, as well as being in a position where they can be ready to go when we pivot and turn back to a normal kind of operation of our county. The first that I feel is essential that should be reopened and should be meeting is the Small Business Commission. This would provide an additional vehicle and tool to assist the county's communication and economic development offices in getting the word out to the business community that needs and is looking for aid and help to survive. It will provide additional voices from the Small Business Commission's regional representatives about existing programs and sources that could help in undoing the damage that has occurred due to the closure of so many of these businesses. It will provide an avenue for business-focused commission members to brainstorm positive ideas to help businesses that could be relayed to Pima County administration and the business community through their continued business experience. It would provide a forum that will help business owners air their individual as well as collective challenges and issues that they are facing so they can be heard and addressed. It would additionally serve as a sort of business community ombudsman to help businesses navigate through bureaucracy and red tape. It could help begin a process to restore our local economy and pivot towards an economic restart in Pima County. It also sends us a loud and clear message to businesses, business owners, and their employees that Pima County recognizes what businesses are going through and how their survival and reopening is so vital to our economy in Pima County, and that Pima County will again be open for business. The second commission that I feel should be allowed to be reactivated is the Pima County Election Integrity Commission. Primary season is upon us with a primary election just around the corner. The Election Integrity Commission needs to monitor publicly all of its activities. A general election is coming quickly. That is also a presidential election. The Election Integrity Commission needs to publicly monitor that activity as well. There is an election milestone process through the primary and up into the general that must be monitored by the EIC through its public input. Public input is the cornerstone of transparency and accountability and is most important with our election system, and the Election Integrity Commission needs to be up and running to make sure all of our voting and voters' rights are protected. And the third commission and committee that I believe should be allowed to be reactivated is the Pima County Transportation Advisory Committee. The Pima County Department of Transportation has been designated as an essential entity for Pima County and is currently functioning. We must keep the repairing and improving of our roads at the forefront of Pima County activity. Pima County Department of Transportation, through and in conjunction with the efforts and input of the Pima County Transportation Advisory Committee members, have just initiated our road repair program by announcing the county's worst to best conditioned roads in the last several days. The process of fixing our roads has just started, and it must continue uninterrupted. 4, countless hours of public input have been devoted to the vast subject of fixing our roads. A process to do so has been identified and is in place. And the Pima County Transportation Advisory Committee must return to and remain active in order to just fix our roads. And after discussion, and as you deem appropriate, Mr. Chairman, I'm prepared to make a motion.
Okay. Before we get into discussion, I'd like to hear from Mr. Huckleberry whether or not it is technically possible to do the either video conferencing or telephonic meetings for at least these 3 committees.
Mr. Chairman and members of the board, it's possible. Again, we're transitioning from Skype to, one of the meetings or the Zooms, and so we can do whatever is necessary to try and get them together, and I would leave it to the leadership of those particular committees as to when they want to meet and how they want to meet via what mechanisms, but they should all be remote. It should either be by video conference or telephone.
Discussion. Supervisor Miller.
Mr. Chairman, if we're going to allow these 3 commissions, if it's possible, and it sounds like it is, I think we should leave it up to the commissions, the rest of the commissions as well. If they have essential business to conduct, I think we should open it up to all of them as they deem necessary. I think we need to caution them that, we have limited resources to make this happen, but if they can abide by that we should allow any of the commissions to meet.
Mr. Chairman.
Supervisor Brownson.
I'm going to direct this to Mr. Huckleberry and perhaps to Dr. Garcia. Given the nature of the COVID response and staff's involvement in it, is this the best use of time for these committees? I'm just, I don't see them until, it looks like we're going to be in this until at least May 30th. I don't see urgency right now for these committees to meet. The Transportation Advisory Committee has advised, and we are implementing the plan they advised, so our roads are getting fixed. The Small Business Commission, at this point, we don't have the kind of information that is useful, but I agree in the recovery process they're going to be instrumental in at least disseminating information. As to the Election Integrity Commission, again, I think that certainly can wait, and we can reevaluate this May 30th. I don't see the necessity today to reinstitute these committees, in my view.
Supervisor Christie.
I should have made it clear from the beginning that all of the commissions and committees that would be meeting would be doing so with the proper social distancing, hygiene, and all of the other precautions that have been implemented in so many of the other areas of Pima County operations. And this same type of either telecommuting or telephonically or Zoom or Skype would be the source of how these meetings would be conducted to make sure that we are acting in a healthy, responsible manner, and that would be part of my motion.
There isn't a motion on the floor at the minute, but I'd asked for a response from staff, and I haven't gotten that yet.
Mr. Huckleberry.
Mr. Chairman and members of the board, as you can imagine, all of management's time is basically consumed at this point with the response. And so certainly they can meet, but whether or not at least upper management will pay a great deal of attention is difficult to do at this point in time. A couple more weeks, it might be better. But at this point, as you can imagine, I think all of our folks are running basically 24 hours a day to keep up with the response to the COVID-19 epidemic. The other, I think, questions were, with the Election Integrity Commission, it's really an after-the-fact kind of review, because what happens, and we're still seeing debate occurring at the state level with regard to how we're going to conduct the primary and general election, whether it's going to be by all mail or whether we'll have a traditional election where people can actually go to the polls. And in that instance, remember, if it is a poll election or even if it's an all-mail election, we still have both parties in the basically role of observing all of the activities and participating in those activities necessary to conduct the election. So that's, the Election Integrity Commission is really an after-the-fact kind of review and of what occurs. Again, the Transportation Advisory Committee, we're implementing those programs right now, and they've been basically set for this fiscal year, and likely we haven't approached the budget for next fiscal year, so there's time in that as well. So I think, while they can certainly meet and they can look at what they feel is important to do in this time, again, having a great deal of attention paid to them with regard to what's occurring is not likely to happen in the next 2 or 3 weeks.
Supervisor Villegas.
Jesus. Okay, got it. Thank you. Out of the three, I think that the small business one might make the most sense, because while we're in this COVID and there's a lot of opportunities for small businesses to get assistance, there's not a lot of mechanisms to get the word out, and there are a lot of small businesses, especially on the south side, that are not getting the assistance that they need to apply for funding. And so if I can ask who would manage the small business one, and that would be the one that would have the priority for me. But as far as staffing, who is that under? I'm not sure who that would be.
Yes, Mr. Chairman and Supervisor Villegas, it is Patrick Kavanaugh, and he is, telecommuting because he has a member of his household is vulnerable. And so my guess is that he could probably handle the Small Business Commission because it's a limited group, and I would think that most of them have the capability to meet remotely.
Supervisor Miller.
Mr. Chairman, the Small Business Commission, I think as we are working our way through this COVID response, I think it would be very important for them to be meeting, because at some point, and I think it's very important for us to put this on the table for ourselves as well, we have to have a transition plan getting people back to work. And I can tell you, I think the community as a whole, what I've been hearing, people are very, very angry and very, very upset about having their businesses shut down. And I think that it would help for them to participate in the process, defining the process for reopening, because they know better than anyone what their business is, if they have to comply with the social distancing and wearing masks and that kind of thing in their individual businesses. I think they're an integral part of that, and I think we want them involved in that. And I agree with Supervisor Christie on the election integrity. I think if we keep it to just the essential meetings, and I don't know who makes that decision, Transportation Advisory, the last I heard, they had already defined the criteria, so they're moving forward for the next fiscal year, is my understanding. Maybe they can wait for a while, but other committees, I think, these two, I think the election integrity, I agree with Supervisor Christie that that's important. I know it's after the fact, but I think they also want to be involved in what's coming up in the election. So as far as I'm concerned, I just think any of these that are, have these essential meetings that they need to conduct, and I think especially the Small Business Commission.
And if we recall, the initial discussion that we had when we started having these meetings was we directed as a board that staff begin putting together a wind out or wind down plan precisely for that reason. And I agree with all the statements that I've heard so far. I'm particularly, like Supervisor Villegas, interested in the Small Business Commission, because I think they have a role to play as we begin to spin this down to try and mitigate some of the damage that's been done, particularly to our small businesses. So one of the things that comes to mind for me is maybe what we need to do, and Supervisor Christie, thank you for bringing this forward because I think it's necessary, is so long as they can have it electronically, whether that be telephonically or by video conferencing, so long as that can happen, that the appropriate staff and the leadership of the said committees determine whether or not they have essential business to conduct, and if they do, they can meet electronically that way. Supervisor Christie.
Mr. Chairman, of course, and I also, as far as the actual meeting format and number of meetings and times of meeting, I think there should be a certain amount of flexibility exercised by the commission or committee or board chair that can make that determination. But two things I just want to bring up. One is my office, and I'm sure my colleagues are experiencing the same thing, are daily receiving heart-wrenching emails and communications from people wanting help, wanting direction, wanting to be heard. And it keeps me up at night thinking of what these small businesses are going through. In addition, I also think of the many hours that the Pima County Transportation Advisory Committee has devoted to our road repair issue, which has always been a forefront issue. And again, with the election's integrity, there are concerns that the public input and transparency might be, the integrity of it might be jeopardized if we don't keep them up and running. But my main point is, I think from an optics standpoint, from a stand-up standpoint of Pima County, we are, by reactivating these committees, telling the community that we are looking for, when things turn around, to be ready and up. It also is a signal that we acknowledge what these various commissions represent, who they represent, what they represent, and that we see the importance and the necessity to keep a dialogue with the community that these commissions and boards fall under. That, I think, is essential, and I think it would put us in that position where, when things do turn around, we're in a much better area to address what's coming next.
Further discussion?
Could we vote on each separately?
On each of the commissions? Certainly. Supervisor Christie.
My motion, if we're going to, in other words, there's a request to separate the commissions, is that, all right? I'll go by each one. I move that the Small Business Commission be reactivated by the Board of Supervisors and be deemed as essential, and return to conducting their essential meetings via video conferencing and or telephonically during the declared emergency.
Second.
Okay, there's a motion and a second, and by way of staff direction, I think obviously the leadership of both the staff and the committee will get together and determine the need for doing that. All those, everybody understand the motion? This is just a Small Business Commission. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it by unanimous vote.
Mr. Chairman,
Supervisor Christie.
I'd like to make a motion. I move that the Pima County Election Integrity Commission be reactivated by the Board of Supervisors and be deemed as essential, and return to conducting their essential meetings via video conferencing and or telephonically during the declared emergency.
Motion and second, and again, as before, is determined by the leadership of the commission and their appropriate staff members. This is on the Pima County Elections Integrity Commission. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay.
Nay.
Nay. By a vote 2 to 3, the motion fails. Supervisor Christie.
Mr. Chairman, I move that the following, I move that the Pima County Transportation Advisory Committee be reactivated by the Board of Supervisors and be deemed as essential, and return to conducting their essential meetings via video conferencing and or telephonically during the declared emergency.
Is there a second to the motion? Motion dies for lack of a second. All right, moving on to item number 6, special emergency meeting. I placed this on the agenda because I wanted to have a discussion on the dais about whether or not we wish to continue having every Thursday meetings, or whether we want to just allow when we need to take action while we get regular updates from staff through the memos. What's the will of the board on that point? I wanted to just have a discussion, see where we were all at.
Mr. Chairman.
Supervisor
I
Bronson.
would concur with you that we have them when we have to take action on an item, and we know every day changes, and we may be meeting every Thursday, but if we don't need to meet, I think we need to shelter in place. We need to practice what we preach. And so I would concur with you that we only hold the meetings when indeed we have to take some action as required by law.
Supervisor Miller.
Mr. Chairman, I would be good with that if we could get updates at the Tuesday board meetings, if we're in
That's a good
between.
idea.
If we could just get an update at the regular meeting, and then if we had to take some specific action, if it happened after the regular meeting, we could do it on the Thursday.
And I would actually maybe suggest that by way of staff direction, that we just get an end-of-week update from staff, obviously through a memo from the county administrator to both the public and to the board. Anyone else? All right, Julie, do we need any formal action, or is it clear? Yes. All right, if there's no further comments, then we'll go ahead and move on to item number 7, County Administrator. Mr. Huckleberry.
Yes, Mr. Chairman, members of the board, we're going to start off with just basically the medical update, and we passed out the latest data, and this data comes from the Arizona Department of Health Services website, and as you can see, it's different than the data that was yesterday. We're up to 512 cases and 20 deaths. And I'm going to have Dr. Garcia speak in some detail about the modeling in just a moment. But I believe that one day this week we had a 415 number that stayed the same. And I think, as Dr. Garcia said, there's always a lot of initial analysis going on with this data, and sometimes it's not completely accurate. And in the case of the 415, that was 415 one day and 415 the next day. A number of cases in the first day of 415 were basically in other counties. And so by the time they sorted through the data and did the analysis, we lost a number of cases, but we also gained an equivalent number of cases in Pima County. So that's the explanation of 2 days that had 415. What I'd like to do, and there's been a lot of discussion about, when will we be out of this? And it's really a modeling issue, and I'm going to have Dr. Garcia go through what he believes is the most accurate model for Arizona and tell you where we are in this process. And if I can get Dr. Garcia to do that, and we're going to put a graphic up that I think is important to see, and it gives you the distribution by time of probable cases and the variable modeling that's put into
Mr.
this
Chairman,
process.
before we get that, just a quick question that goes to a point you made earlier. In terms of the number of deaths and the number of cases, with the private testing labs, is that included in the number of cases, or just some clarification on that?
Mr. Chairman, Supervisor Bronson, you're absolutely correct that one of the things that has made our life much more interesting has been the fact that most of the testing is now occurring in the private sector. What that means is that rather than the health department actually knowing each of those folks before that specimen was sent off, the opposite is true. We do not know about any of these folks until the test comes back positive. If I could just take 2 minutes to sort of explain how this works. So when a person presents to their doctor and the doctor orders a test, if it is a reportable test, what the laboratory does is it generates these batches of positives that are then sent to the state public, the Arizona Department of Health Services. The lag between when the test was actually collected and when those batches are transmitted can be anywhere between 2 and 12 days. And that's why you see variability in the state numbers on a day-to-day basis. It's not that all of a sudden there were 2 more cases a week ago. It's that reporting is catching up. You can imagine now with approximately 7 different vendors that those batches, that batched information is coming on different schedules and with different degrees of reliability. The state public health, the Arizona Department of Health Services then transmits the positives that are pertinent to the county to the county health department. That's the first time that we will see most of those tests. In many cases, the patient was already notified, the provider already knows, and we may be coming into this 10 days after that actual test was performed. So yes, thank you for asking that question, because that explains some of the noise that you're going to see. And that's part of the reason why Dr. England has really focused on really thinking about the long-term trends rather than the day-to-day variability.
Supervisor Miller?
Mr. Chairman, on that same topic, then shouldn't we be reporting the Arizona Department of Health? I think it seems more accurate on a daily basis versus Pima County playing catch-up as they transmit this data down to us. Shouldn't we be to give people a more accurate information to give them the Arizona Department of Health data?
Dr. Garcia.
Mr. Chairman, Supervisor Miller, I wouldn't characterize it as more accurate. I would characterize it as different, but you're absolutely right. The policy decision is to lead with the state numbers, just so that there is less ambiguity and fewer questions from the general public and from the media. We still have a lot of confidence in our numbers. We still know that there is a fair amount of error that needs to be cleaned up after we get the data from the state. But I agree with you that it causes less confusion and less heartburn for everyone if we lead with the state numbers. That's why you have those in front of you.
Mr. Elgabre?
Yes, Mr. Chairman, and that's why we're only going to be reporting these numbers going forward. So you won't be confused with what we think we have and don't have, and we're going to rely on the state numbers because they will settle out and be probably, I wouldn't say more accurate, but at least we can report consistent information.
Mr. Chairman and Mr. Huckleberry, yeah, when I say more accurate, it's more accurate on a day-to-day basis because it's more timely information. But right now, this information is on the website, so are we taking this information off the website? Because I am getting a lot of calls and a lot of contact over these numbers don't match these numbers, and people are really confused.
Mr. Elgabre?
Yes, Mr. Chairman and Supervisor Miller, we'll take the county reporting off, and if you go to a link on that, just below the county reporting, you can link on this. And so people will be able to link on this. If we see any significant discrepancies between our data and the state's data, we'll resolve that with the state.
I just think there's a lot of angst, and that link is right below where people look at this and then they click on that link, and that's what I'm getting calls about. And also, as we all know with the modeling, the inaccuracies or the learning curve, and I've taken an econometrics class, so I understand the complexity of these models and how over time they're going to improve. We don't even know all the variables yet, and then we got to know how to weight them, and is there any correlation between the variables and on, and people don't understand that, so they just think we're a bunch of buffoons up here with a modeling, and I really question at the national level reporting the initial kind of guesstimate model, starting with that and putting that out there and just really creating a lot of angst. And then as we go on, they see it coming down and down. And I think the last I heard last night, it went, 240,000 down to 200,000. Now I believe it's down to 60 was the last I heard, as they refine it, as they get more information. But I think this is also, people are already angry over that, and then they see these two different numbers and they don't understand the difference between the two. And I think that's a really good plan to take this down off there and just keep our own data internally. Thank you.
And as a point to modeling, I would only, to put it in common terms, I would look at weathercasting is done by modeling. And at the beginning of this week, it was going to rain yesterday and the day before. and I don't remember it raining. So it's important to understand that this is a modeling is a best guess on the best information and methodology we have at the time. Supervisor, Dr. Garcia.
Thank you, Mr. Chairman. Thank you, Supervisor Miller, for those comments. Modeling is indeed a complicated exercise, and we use modeling in public health. We use it when we are not able to analyze the data in any other way, when we can't possibly create these kinds of experiments that would generate real data, because we just can't see into the future. Modeling should only be undertaken by expert folks, and we do not actually have that expertise within the health department, and I would never represent that we have that expertise within the health department. That is something that the big institutes like Battelle and Rand, they're the ones that really, and the large universities, they are the ones that are really have that analytic skill set. I'm going to talk to you about the current model, which is in greatest favor in the public health sector, and that is the Institute of Health Metrics, which is out of the University of Washington. This has been the model that the President's task force has actually relied on. And you're absolutely correct to say that as the real world observations come in, they end up shaping and informing the accuracy of the model on a go-forward basis. And so that's why you get this sense that it's a moving target, because quite honestly, it is. These are dynamic things. These are not clinical controlled trials. So I just want to walk you through what some of the predictions are. And this is how that particular model, which has been used by the President's task force, really plays out here in Arizona. And knowing that Arizona's bed utilization and case rate and deaths will actually be driven mostly by Maricopa County and to a lesser extent by Pima County, I think we can take away some really important lessons. So what you see on the screen right now is bed count, estimates of the bed count utilization at different times, at different points in this pandemic. And what you see that the current model predicts that maximum bed utilization across the state will occur around April 22nd. You also see that pink shading, which expresses the confidence intervals around that estimate. So you can see that there are very broad confidence intervals, i.e. it could be a lot less or it could be a lot more. The further away you get from today, the broader the confidence intervals are, right? Having said that, and with all those limitations, the current modeling from this and from other models predicts that we should be hitting peak in the state of Arizona toward the end of this month. Some models have said the 22nd, some models have said the 27th, but that is where we currently are looking at. So the question then becomes, how does that fit with the bed capacity within Pima County? Again, we only represent 15% of the state's population, and for 15% of these potential cases, the bed capacity that we have on hand should be able to meet that demand. That is, if we have a healthy healthcare workforce, if we have staff and supplies in those institutions, and if our hospitals don't go offline for some other disaster or for some other economic need. So, Spencer, if you could place the second graphic, please.
Mr. Chairman, before you move on from that graph,
Supervisor Miller.
is this strictly Pima County? Because it shows that we have 6,000 beds.
Chairman Valadez, Supervisor Miller, this is not Pima County. This is the state of Arizona.
The whole state. Do we have the same chart for Pima County?
No, we do not.
Okay. Do we know what our projected, I guess we don't know what our projected needs are going to be. We don't have any of this information down to the county level.
So we know what the bed capacity is at the state level, and you saw, Chairman Valadez, Supervisor Miller, you saw that the governor yesterday issued an executive order mandating that hospitals and other healthcare institutions report on a regular basis bed capacity, ICU capacity, ventilator capacity, staffing, and a couple of other items. Please realize that healthcare institutions have normally done that, but it's also a little bit of a proprietary information that sometimes is not always shared easily. So the governor's action allows us to have greater transparency in terms of the assets that are available on the ground. I can tell you, for instance, that as of this morning, what our bed capacity is. So as of this morning, we have, out of 384 staffed emergency department beds, we know that 255 of them are available. I can tell you that in terms of our inpatient medical surgical bed capacity, out of 1,631 beds, staffed beds, we have 466 that would be available. I can tell you that in terms of our ICU capacity, which is 315 staffed beds, we have 153 available. This is one of the challenges that really is stressing our healthcare partners in that these kinds of vacancy rates, this kinds of underutilization is something that is relatively rare in the healthcare sector. We operate in the healthcare sector on relatively small margins, and this is part of what's causing a lot of economic pain to all our hospital partners, regardless of what their fiscal condition was ahead of time.
Mr. Chairman, one of the things that I've been hearing is a lot of healthcare workers in Pima County are getting laid off from the Northwest Hospital, I'm told, had a layoff, and several other facilities because they're not allowing elective surgeries and that kind of thing. And so I guess this is creating just a nightmare all over the place. And I understand. The second category that you had, you said there were 1,031 beds capacity and there's 466 available. What did you say that was? Medical?
Medical, surgical.
Surgical.
Yeah.
And
why are there such a high utilization there? Does it have to do with the COVID, or is it just essential surgeries that are taking place?
And if someone could please address both of the questions, including the furloughs.
Chairman Valadez, I didn't hear the second.
Sorry, if someone could also address the issue that the Supervisor Miller brought up of the potential furloughs at some of the hospitals.
So I'll talk about the bed capacity issue. So what I said is that of 1,631 staff beds, currently there are 466 that are available. That means that 28% of the capacity is not being used. So that's actually a lot of empty beds from a hospital standpoint. So all our hospital partners, all our tertiary care partners are having to look at a variety of strategies to manage their personnel. You can't have people in the hospital being paid to staff these beds if you don't have the patients there in order to take care of. A variety of strategies have been employed that include furlough and furlough type of actions. And the issue is a very serious one and is impacting every single one of our hospitals.
Is there...
Let me, Supervisor Miller, if I could ask Mr. Huckabee to address the rest of that question.
Yes, Mr. Chairman, if you looked at the material we gave you, we indicated there were a number of questions that we have forwarded to the governor and the governor's office with regard to this issue. A lot of it dealt with licensure related to skilled nursing facilities, but the last question was on point with regard to the issue of hospitals and their low utilization and fiscal stability. And what we asked is that they begin to request out of the Center for Medicare and Medicaid what we call prepayment of those approved hospitals or facilities that are Medicaid available. And apparently, as of about yesterday, there's been some discussion in an executive order that I haven't read yet that started to release some of those monies to, I think, the more rural hospitals, but we've got to get some more information about it. And, I think the initial discussion was $50 million or $55 million. I've heard that now is being revised and being pushed up to, it sounds like almost $200 million. So some of that is actually starting to be addressed, but it's, again, the unintended consequences of being maybe a little early on elective surgeries and elective procedures that the hospitals can typically turn people in and out in a day or two. So, but it's the way it is, and we do have the capacity, and the issue of fiscal stress is being addressed.
Mr. Chairman and
Supervisor Bronson.
Dr. Garcia, Mr. Huckleberry, in terms of the electric surgery, that was something that came from the governor's office. Is there any movement about maybe reversing or loosening that up a little bit?
Dr. Garcia.
So, Chairman Valadez, Supervisor Bronson, there are a lot of discussions that are happening at the policy level with the governor, within the Department of Health Services at the state, across the different county health departments, and across a range of stakeholders. And a lot of what has been focused has been, the focus has been how do we adjust our response in this sort of evolving pandemic? And I wish I had more satisfying answers to you, other than to say that a lot of smart people are spending a lot of time on this, that I don't believe that we have a clear understanding of what success looks like, of when the end looks like. But that's what these modeling studies help us to inform.
But essentially, that decision is going to be made at the state level, not at the local or county levels, right?
Chairman Valadez, Supervisor Bronson, you're absolutely right. So in order for these kinds of strategies to work, that is shelter-in-place kinds of strategies, they have to be done at the state level. That is what we had been advocating all along, or what we had been proposing all along. It does not make sense to have a patchwork of restrictions that then lead to enforcement issues that then lead to hotspots. So yes, my anticipation is that this is the course until the governor provides an order to the contrary.
Mr. Huckleberry.
Yes, Mr. Chairman, I think if you get through the balance of Dr. Garcia's presentation, you can see that the issue associated with whether or not you start relaxing rules of hospitals should be made on the downside of this curve, not on the upside of this curve.
Mr. Chairman.
Supervisor Miller.
I wanted to ask Dr. Garcia to comment. If you look at the categorization of the COVID cases by age group, I find it, they identified initially early on that the most at risk were the senior population, and it appears that the 20 to 44 age group is the highest. And I'd like you to comment on that if you have any data or information.
And I actually have asked the same question. He's actually got a pretty good answer, Dr. Garcia.
Chairman Valadez, Supervisor Miller, what you're seeing is an artifact of where the testing is occurring. So the largest number of testing by several thousand-fold is occurring among that younger age group. If you look at hospitalized individuals, if you look at the ages of hospitalized individuals, I can tell you that it's a very different age distribution. And if you look at deaths, it even skews further to the right. So you're absolutely right. Lots of cases among the 20 to 45-year age group, and that makes sense because that's the group that is getting the most testing at this time.
Mr. Chairman.
Supervisor Christie.
Quick question to that statement by Dr. Garcia. Also, in that age group, are there not mostly emergency technicians, frontline folks that are the most exposed, that are receiving the testing?
Dr. Garcia.
Chairman Valadez, Supervisor Christie, you're absolutely right. That is the group that includes healthcare workers, first responders, both of whom, if they are symptomatic, are being tested at very high rates. You are correct.
Mr. Chairman?
Supervisor Mill.
I was notified by a healthcare worker that she was tested. They're doing antibody serology testing at Arc Point Labs here. She was tested over the weekend. A company, Escalera Health, has been offering it to their employees. Are we going to see more widespread testing of people for the antibodies to see if they have it?
Dr. Garcia.
It's supposedly coordinated with Pima County Health Department, so.
Chairman Valadez, Supervisor Miller, what you're seeing is an escalation of testing across the state of Arizona. Much of the testing being done by private entities, including Banner, including Escalera, including El Rio, including a variety of partners, are, because of the scarcity of that testing resource, we continue to focus as a group, including these private sector partners, we continue to focus on the populations that are at greatest risk. So either older people or young people, relatively younger people who are symptomatic, who have been exposed, and who need to be tested.
Supervisor Miller.
That is for, testing to see if you have the virus. But she's talking about they're just testing them, the healthcare workers, to see if they have the antibodies in their system for COVID. Chairman
Valadez, Supervisor Miller, the antibody test was just approved this week. I'm not sure what assay they're using. This is an area of controversy, but that information is likely to be useful, at least to identify what proportion of that healthcare workforce may already be protected by their own immune system.
Okay. So this is not, you have not coordinated with these organizations to do the antibody testing. She's incorrect on that.
Chairman Valadez, Supervisor Miller, I became aware that they were doing this antibody testing 2 days ago.
Thank you.
All right, Dr. Garcia, I think you have more of the presentation.
Oh, so one of the very logical questions that you have to ask me and that has been presented is how do we start planning for when this is over, and what kinds of data points do we start doing that? What you're seeing here is a projection of deaths per day and when they're projected to peak out. And you can see that for the state of Arizona, that is projected to happen sometime before May 1st, in the May 23rd, the week of May 23rd. What you can also see is you start seeing the projection of what the decline will look like. Right? And you can anticipate that we will stop having active cases, toward the end of May. Certainly, we will stop seeing the increases in deaths that we've been seeing at the end of May, beginning of June. So from a planning perspective, what we're starting to think through is what happens at that point, and is that when the governor may issue a executive order rescinding his previous actions to shelter in place, and what are the challenges that this will present? One of the things that I worry about, one of the things that all of us in public health are worried about, is that as the restrictions are loosened up in order to permit economic and social interchange, that we will start seeing other little peaks, a little bursts of disease. And so we have to balance that increased economic activity, increased social activity, with some risk tolerance, some tolerance for some additional cases that then we're going to have to chase down. So this is our best projection that sometime in June 3rd will be when we will start seeing the beginning of the end of this pandemic.
Mr. Chairman?
Supervisor Miller.
There's a lot of reporting about how deaths are being classified, that the CDC has a definition, and I've seen a lot of reporting from physicians and that are talking about the fact that a lot of deaths are being classified as COVID-19 when in effect in fact, they may not necessarily have been caused by the COVID-19. They had underlying conditions, that kind of thing. How are we classifying our deaths here in Pima County?
Chairman Valadez, Supervisor Miller, the death certificate and the cause of death is strictly the province of the certifier. That is the physician who fills out that death certificate. When it is the office of the medical examiner, we have pretty strict criteria about how we come to those assessments. But in most cases, in the vast majority of cases, because OME cases are a relatively small minority of the entire number of deaths that occur in this county and in most communities, those decisions are being made by the physician on the ground who last took care of that patient. And she or he is using their best judgment to attribute a cause of death to that event. And usually it takes into account a person's past medical history and what other things may have been going on. So a gentleman who has respiratory symptoms and COPD because of chronic smoking, who has an exacerbation, the cause of death will be respiratory failure. And if that person was, recently seen or had recent testing or was recently suspected of being exposed to COVID-19, there may be one of the other diagnoses may end up being, COVID-19 related. To be clear, COVID-19 itself is not the cause of death of most of the deaths that are occurring. It is respiratory failure, it is cardiac arrest, it's a variety of other things, but it is a complicating element and will be listed as a second or third diagnosis in that death certificate. But that is being done by individual physicians at the time that she or he fills it out.
And is the medical examiner's office bound to the CDC criteria for classifying these deaths?
Supervisor Miller, Chairman Valadez, Supervisor Miller, I need to refresh myself, but I do not believe so. We actually have our own set of criteria. We're actually conducting, when we feel that there is a need to ascertain whether a death is COVID-related, we actually are collecting viral swabs. As precious as that testing is, we believe that sometimes for some of the cases where we are trying to adjudicate the cause of death, that testing is really critical. No, I do not believe that we are actually bound, but I need to double check that.
Mr. Chairman.
Thank you.
Supervisor Christie.
Dr. Garcia, just to be clear, you just mentioned, and just to reiterate, the COVID-19 virus in and of itself is very rarely, if ever, the actual cause of a death. But when there are underlying factors of health issues accompanying the presence of the virus, then that is what the issue really resolves. But in and of itself, the COVID virus does not cause death, generally speaking.
Chairman Valadez, Supervisor Christie, COVID-19 as the sole cause of death would be a very rare event. Doesn't mean it can't happen, but it would be a very, very rare event. Most of these folks, the folks who are dying in the ICU, and most of these folks are dying of the complications associated with this infection superimposed on other disease processes.
Mr. Chairman, just real quickly, I do notice that at times when deaths are reported, that there is a little detail about the individual who passed away might have had a underlying effect. I think to give everybody a real sense of what this virus does, that it's important that that the public understands that in the vast majority of the deaths, if not all of them, there is some underlying health issue associated. And unfortunately, the virus just exacerbated what was already there.
Chairman Valadez, Supervisor Christie, you are indeed correct. So I have the opportunity to review each of those decedents, each of those cases of mortality. I can tell you that of the ones that I've reviewed, there has always been other complicating. I have not looked at two of them, so absent those two, for all of them, there were other exacerbating factors, for instance.
Dr. Garcia, is that your presentation? Okay. Mr. Olcaberry.
Yes, Mr. Chairman, members of the board, I'm going to go very quickly with the balance of this, coordinating economic and business assistance. We've stood up the web pages of Pima Works, and it's being pursued out of our Community Services Employment and Training organization, and it is up and running. In addition, to assist primarily the restaurant industry, we've stood up something called Pima Eats, and it is getting quite a bit of activity on our webpage, and we'll continue to do that. We also are, the governor's latest executive order, I believe yesterday, dealt with the issue of raw food products and the sale of those raw food products from restaurants. I believe that he gave in his executive order a series of criteria, and we want to stress that there's not a carte blanche approval to sell, that you must still meet the food code. And in particular, we're developing rules and regulations that should come out toward the end of today that deals with the sale of raw materials or raw food products, or the reprocessing of bulk orders into individual orders, because food has to be handled. And so we'll have those rules in place by, I hope, the end of today. So that is occurring, and obviously an additional element to try and assist restaurants. So if, and I think obviously one of our biggest challenges, and we're pursuing this, is really how to assist those in the business community, and particularly small businesses, in those application processes, the Small Business Administration and the rest, that appear to be fairly complicated and difficult to proceed. And so I know that Patrick Kavanaugh and John Moffitt are both working in that particular arena to try and assist those individuals. And with the activation of the Small Business Commission, that should also help. I will then kind of move on for a little bit with regard to the personal protective equipment supply and other related activities. And we can have staff talk about that, but I think the answer is, if you look at some of the material we gave you this morning, and it's the title at the top of it is Daily Executive Briefing. You can flip over on that first page, and you can see we've added now a column that really talks about, and it's, you have to use page 1 and page 2 together, but delivered this week. So one of the things we've been reporting previously is all the items requested, the requesting entities and agencies, and so you get a better clarity with regard to the flow of supplies and personal protective equipment into the EOC. We'll continue to try and refine this, and I think we'll be able to actually put it in a transparency process on a web page with drop down, so you can see every agency that's requested, every agency that's had particular supplies provided, all of the orders that have been placed, all of the orders that are in process, when the anticipated date is that we receive them. And so we'll get basically the logistics of the supply chain a lot more transparent than just simply this information you see today. So let me turn it over to perhaps Mr. Voorhees, and see if you have anything else to add with regard to supply chain.
Colonel Voorhees.
Good morning, Mr. Chair, members of the board. I did have some prepared remarks, but I'll go straight to the point. Our supply situation has improved slightly with some increased supplies coming in. We have done some business with a local company called Syncardia, and we have received about 100 gallons of sanitizer, which we are distributing to local agencies that are in need, as well as our own Pima County employees. Most of our deliveries are still in process. As you can imagine, the supply chain is simply just not as efficient as we would expect it to be at this point, and so we are very vigilant to seek out multiple vendors, multiple sources, and try to diversify our sources in order to get things in as quickly as we can, but we have committed funds and we don't want to overextend ourselves either. I did want to mention that we have had a significant outpouring of support from the local community in terms of volunteer donations. We have had 32 individual donations that have comprised 110,000 gloves, over 4,000 N95 masks, and 3,000 surgical and face masks, as well as companies who have reprogrammed their 3D printers to print out 78 face masks. While that represents a relatively small amount of the actual need for first responders and hospital workers, that is a very significant contribution by our community, which is to be commended for their efforts in trying to help out those in need. I also wanted to highlight the fact that your Emergency Operations Center did practice distributed operations, those operations outside of the Peacock building in case there was a disease outbreak in the facility. We'll let you know that you can have confidence that the EOC team can meet at home, in offices, or any other distributed location and conduct our operations efficiently as well. And we had tested that last Wednesday, and there's a report to that effect. Pending your questions, that's all I will have in terms of my remarks. Spencer Graves, our logistics team chief, is also here available to answer your questions.
Mr. Chairman?
Supervisor Miller.
I just had a quick question. I saw on the website that you're taking in donations via the fire stations. Is that all fire stations within the community? I've had individuals contacting me telling me they have gloves and supplies, so they can go to any fire station.
Mr. Chair, Supervisor Miller, there are 19 fire stations that have been identified as donation spots to date. We have received donations at 10 of those 19, but all 19 are willing to assist, and we are always soliciting for more donation spots. I think a lot of that, any fire station that has not volunteered to be a donation point is probably already logistically challenged. They're out in the field a lot, and they simply don't have the ability to help with that effort.
Is there a list of those on the website somewhere?
Mr. Chair, Madam Supervisor, yes, that's on our COVID-19 website.
Okay. And I'll look for that. And what kind of outreach are we doing to the community? Because I have people contacting me directly. Have we, maybe Mr. Foster can put that out there, that we're accepting donations at the fire stations, and people are just on social media. I think Pima County has put it out on social media as well.
Mr. Chair, Madam Supervisor, we are very aggressive in putting things out on social media, all different venues. We have spoken with the HOAs, larger HOAs within the community through the Nextdoor app and other social media platforms. We also have our own community liaisons within the Emergency Operations Center to include faith-based organizations who are currently in a meeting discussing state and government or federal funding from about 9 o'clock until about noon today, going through the process. So all 1,200 churches in Pima County, as well as other charitable organizations, are attending that meeting teleconference.
Thank you.
Yes, ma'am.
Mr. Ogleberry.
Yes, Mr. Chairman, if there's no other question on item C, which is the personal protective equipment supply chain, D&E have essentially...
Hold on.
I had a quick question for you on the Pima Works. You state in the documentation that you're awaiting some guidance on, let me see where it is. It's on that first page.
Yes.
That we're not, the distribution of those funds can't happen until the U.S. Department of Labor provides guidance on that for the applications. What are we waiting for? They didn't give the criteria, or?
Yeah, Mr. Chairman, what we need to do is basically get their blessing on the processes that they're, involved in and what they will accept. And as of when I wrote this on Monday, I have not had an update with regard to whether or not that's in process. We can find that out and provide the information to the board. But as of Monday, when this was written, we didn't have that guidance.
That's still one of the bottlenecks in
Yes.
getting these monies out there. Okay, thank you.
Mr. Ogleberry.
Yes, and I think Dr. Garcia's hit the area of hospital preparedness, and we've talked about that. as well as the critical equipment with regard to ventilators. We'll continue to probably report that in this standard weekly update that we'll do to the board, regardless of how often we meet. We have a section on protecting the most vulnerable, and I need to update you on that. Again, the homeowner association coordination is going quite well, and we're interacting with the other towns and communities to assist them. So that process is in place. Food security and accessibility, I want to kind of draw your attention to the April 8th memorandum that I think I just passed out this morning, because we got it after 5 o'clock yesterday from Diana Durazo. And the one item I would like to have some direction from the board on, as you can see, we've been discussing with the community food bank a lot of activity with regard to the food pantries and access to food in the more rural areas. The community food bank, based on demand, has concentrated a lot on the urban area, the metro area, and so we need to get them to actually, we need to supplement their activities in the more rural areas, and that deals with redirecting some CDBG funding to the community food bank to provide that mechanism for those pantries in those more rural areas that need food and need food accessibility primarily. And there's a number of contracts that we'll enter into, and what I asked the board to do is to, again, you can take a look at this memorandum, you can reference this memorandum to where we could enter into contracts with the food bank to provide services to these rural areas and redirect CDB funds, and then bring back those contracts for ratification at perhaps the meeting of the 21st. And so that would then negate the necessity right now to have another meeting next Thursday. But the board needs to basically provide that direction. In addition to that, and this doesn't require board direction, is that in working with the community food bank, we're talking about repositioning certain county employees with certain skill levels that are needed to basically assist the community food bank in providing the food supplies and distribution. And that really is in our commercial driver's license employees and our employees who know how to operate forklifts. So we're in the process of developing a list of employees who can, in fact, alternate between what they do regularly and what they do, and we can assign them to the community food bank at certain locations to provide these services, and we will provide them with their normal pay. And what's happening in our public works area is that, and I'll use the patch crew as an example, normally we have 4 patch crews out at any one given time. In order to spread out the possibility that we could, in fact, infect a particular crew and have that go to others, we basically now have them on alternating 2-week schedules. So, 2 crews are on 2 weeks and then off for 2 weeks, and so while that crew is off, they will then be provided the opportunity to work in these particular areas, basically supporting the nonprofit services that are used in primarily food accessibility and food security. So I don't really need any direction on that. I think we're capable of doing that because we're basically supplementing the strength of that safety net system. But I do need some direction with regard to entering into contracts with the community food bank, redirecting and directing CDBG funding for that purpose to support these more rural areas. And you can see we've got some estimates already, and you can see on the next page it to be determined. So this is an ongoing activity. And even as of this morning, we're working the details out with the community food bank for some of the more rural areas to supplement their workforce.
Do you need that by way of a motion or just direction?
Mr. Chairman, I believe it would be better to have a motion and a vote.
Chair would entertain such a motion.
I will make them, and we need it in what form?
I think just simply to reference the memorandum of Diana Durazo dated April the 8th that lists a series of communities and towns that may need food assistance, and to authorize the execution of those contracts by the procurement director or the county administrator to be ratified by the board on the 21st meeting of the board, and so that we can then proceed immediately with providing food services to these rural areas.
That's my motion.
I'll second.
Motion and second. Discussion? If there's no discussion, all those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it unanimously. Ms. Huckleberry.
Yes, Mr. Chairman, under 3 volunteer program and donations, I think Mr. Voorhees has covered that particular area well. The issue of policy questions, I think we've discussed that previously, with the most important question being the advance payment to hospitals for their financial stability. And I did reference on page 4, item Roman numeral 4, a daily situational report prepared by the Pima County Sheriff and the sheriffs here. And that situational report, as you can see, I've included it. It gets produced every day. It is helpful because it gives us the ability to understand the operation of the Sheriff's Department from both a law enforcement perspective as well as the perspective operating the Adult Detention Center. And I'm pleased to report that the Adult Detention Center population today is down to 1551. So I would ask the sheriff if he has anything to add.
Sheriff Napier.
Mr. Chairman, members of the board, I thank you. We're proud to be able to produce that report and distribute it each day. We've made remarkable steps without imperiling public safety to reduce the population in our detention center. It's fundamentally necessary because we have to have space should the virus encroach inside the detention center to isolate inmates that become infected. We're not seeing a rise in sick leave usage by our deputies or corrections officers. They're standing tall and serving the community exactly how we'd expect them to. Currently, we have no infected employees that we're aware of or any infection within the walls of the detention center. So we're really doing very well right now. It does not mean that we're not facing significant challenges. These are challenges that we would have never imagined a mere few months ago. If I said I was social distancing 3 months ago, people would have looked at me like I was crazy, and now that's part of our normal vernacular. Most certainly, in the manner in which we provide law enforcement services, we never anticipated the need to incorporate in that social distancing, the routine wearing of PPE equipment or things of that nature. So right now, the Sheriff's Department's functioning very well. I attribute that to the brave men and women that have served our community with honor for such a long time. They're definitely up to the challenge, and we're firing on all cylinders right now. We have regular meetings with the executive staff to update us. We are operating as we would in any other critical incident. With a incident command structure that's very organized. It's how we would address any other critical incident. And we've practiced like we played, and we're very good at facing crisis like this because it's something that we do on a regular basis. So I appreciate the acknowledgement from the county administrator, the support that we enjoy from the board and from Mr. Huckleberry and his staff.
Thank you, Mr. Napier.
Mr. Chairman, I had a couple of questions for Mr. Huckleberry.
Supervisor Miller, please proceed.
One of the things that I didn't see an update on, and I know that Dr. England expressed grave concern about, was the homeless population. Do we have an update on that, what we're doing there?
Mr. Chairman and Supervisor Miller, basically we have suspended our homeless encampment process where we relocate them. We have also basically talked to social service agencies and made sure that we are closely connected to those encampments so that if there is an infection that it's dealt with from a public health perspective immediately. And so I think we've been in almost daily contact with the shelter services, and so that is really how we're addressing the homeless population.
Are we doing anything like is happening here when I come in the boardroom, the nurse comes by and takes my temperature? Is that something that's happening at the shelters?
Mr. Chairman and Supervisor Miller, I cannot answer that. I don't know if Dr. Garcia knows how they're actually dealing with their intake into the shelter. I would assume they are, but I'm not sure.
Dr. Garcia, any clarification?
So there's Chairman Valadez, Supervisor Miller, there's a variety of, we are fortunate in this community that we have a variety of agencies that serve street living, homeless, unsheltered individuals. And each of them has been very proactive in trying to come up with approaches to mitigate the risk for their population. Some have elected, for instance, to close off further intake in order to decrease the risk for the already housed population. Some have looked at a variety of symptom screening and temperature screening kinds of strategies. I know that we are actively part of those conversations with those agencies every day. One of the things that Dr. England, as well as Arnold Palacios on the Community Services Employment Training side have been working on is coming up with resources so as some of these shelters stop taking additional residents, that we have alternatives for placement. And so we've started looking at hotel vouchers, et cetera, mechanisms that we've used historically in health and in housing to be able to house some of those families and some of those individuals. Thinking specifically also about how we might separate sick folk from non-sick folk. It's a complicated task and it's an ongoing scope of work.
Are we aware of whether or not we've had any cases within the homeless community?
Dr. Garcia.
Chairman Valadez, Supervisor Miller, I can tell you that we have not had any deaths in the homeless community, and I can tell you that with certainty. Out of the hundreds of cases or the hundreds of positive tests, 502 positive tests in Pima County, I can't tell you what percentage of those were done among homeless and unsheltered individuals.
Is there any way to track that or get that information, or is that?
For the positive ones, one of the things that we do is we go back to, after we get the results from either Sonora Quest or whomever the appropriate lab is, one of the first things that we do is we contact the healthcare provider, we identify who they are, and we start digging into the chart. And that's where that information will be. El Rio Community Health Center is our biggest provider of health care to the homeless. They also have some of the most robust testing and follow-up protocols. We are confident that they are testing appropriately. We are confident that they are managing their patients appropriately, and that we are being informed when a person is potentially street living, unsheltered, homeless.
If they get that information that an individual living in a particular shelter is positive, is that information being taken back to the shelter to let them know, or is that person being isolated? I know how difficult it is, but is there any mechanism in place to isolate those individuals?
Chairman Valadez, Supervisor Miller, that's exactly why we're looking at hoteling. And I can tell you that we have had to actually exercise that option because we would not want to put someone who has not yet recovered, and that's the key part, right, who has not yet entirely recovered from their disease back into a population that is already at risk. Remember, a lot of these folks are folks who are chronic smokers, who have all these other health conditions, who've been living on the street, and you're just not going to want to reintroduce them. So the strategy would be for us to find alternate housing for them.
And have they, I don't know how many of these cases we've had, but is it a willing situation, or have we had to force them and go through the judicial process of allowing them to have public defense?
Chairman Valadez, Supervisor Miller, at this point I can tell you that most people have been cooperative. It's a very small number, just to be clear. It's not like there's a huge number of these cases. I can tell you that we have come up with equitable and voluntary solutions that protect the health of protect the health of the community and preserve the rights of the individual.
Thank you.
Mr. Gobert.
Yes, Mr. Chairman and members of the board, there are really three other items on the agenda. The last item, and I think all of those require direction from the board to accomplish. The first one is the deferral of lease payments, and I'll come back to that one in a second. The other one is in the addendum that is Addendum 1. And as I've indicated, we're developing a temporary policy for the novel coronavirus on the board's agenda. And there are a number of sections to it. Several of those sections have already been acted on by the board. For example, the federal family leave portions and our pandemic leave portions. We have added a few things that we believe are important to do. The two that would require some direction and the one that requires direction without question is the issue of temporary COVID premium pay. And that is a proposal to pay any employee who is still required to be an essential employee providing public service, and where they do not have an opportunity to use social distancing or to have adequate PPE, that they be afforded the temporary assignment of additional premium pay of $2 per hour. And I would like to make that effective if the board concurs. The first pay period that begins on Sunday, which is, I believe, the 12th of April. And my belief is that given what we project with regard to the length of this particular event, it will probably go through June and perhaps to the end of the fiscal year. So that is one that I definitely need action on. The other item deals with something called COVID-19 furlough. And furlough is a new introduction of a term into our process. And this would be for those employees, and we have several hundred in the county who have very low leave banks, meaning earned vacation or sick leave. And as this pandemic drags on through the end of May, we may have employees who will have exhausted the board-approved pandemic leave, the federal leave, and then their own leave banks. And they then need a process to start now if they wish, because in putting them in a furlough status, I believe, makes them available for unemployment benefits. And if you start now or begin that process now for furlough and have it known to be available, they can begin to apply knowing when they're going to exhaust all of their leave banks. The benefit of furlough is that it's different than what's contained in the merit system today is a layoff. And once a layoff occurs, then reemployment of that employee is more difficult. On the concept of a furlough, that employee would be actually immediately called back to work the moment or the day that there's another executive order lifting the stay in place or stay at home policy. So it's those two, it's those three that need some direction. And again, there's a fairly long memorandum on the issue of lease rent payment deferrals, and I'd be happy to answer any questions on that or the other two that I would like to have board direction on.
Mr. Chairman,
Supervisor Bronson.
I'm going to make a motion and then we can have a discussion. I'm going to move to the items regarding temporary COVID-19 premium pay and move that we approve that per the Mr. Huckleberry's memo of April 8th, and that it become effective for the pay period beginning April 12th. Then I'm going to move that we approve the COVID-19 furlough policy as expressed in Mr. Huckleberry's April 8th memo. So that's by way of a motion.
Second.
And that the COVID furlough be effective once those leaves are exhausted, just for purposes of clarification.
Second. Any discussion?
Mr. Chairman,
Supervisor Miller.
everything in there, the premium pay troubles me because of the public, the private sector folks are out of work. Their paychecks ended on May 19th at 8 p.m. They're getting nothing. And I think this sends a really bad message to the community. People are lucky to have jobs right now. Anywhere you are, you're lucky to be getting a paycheck. And there's a whole lot of people in this community that are getting nothing since May 19th. And as much as I think, you know, I'd love to give everybody money, and I know we all would, but I think this sends a very bad message to the folks that have gotten zero, that are out of work. And I just think it's, you know, we should consider ourselves very lucky that we're still getting a paycheck at all. Unlike the folks that have gotten nothing and they have children and families, and they are not seeing an end in sight. And if we're elevating people's pay right now, I know they're essential employees. We have the types of distancing. We have, you know, people can get masks and that kind of thing. I just think it sends a very bad message to the community that we care about ourselves, but not so much about you. And I think that's my issue with this. I think the rest of the memorandum about the furlough, et cetera, I'm very agreeable to. But on that item, I think it's just sending a bad message to the community.
Supervisor Christie?
Do we have an example of some of these employees that would be recipients?
Yes.
Potentially?
Mr. Huckleberry.
Yes, Mr. Chairman and Supervisor Christie, I think the best example is sheriff's deputy.
Yep.
When they arrest somebody, they can't social distance. They have to go hands-on with that individual.
Yep.
So it puts them at a higher risk. And I purposely not stated this as hazard pay because it's basically to provide some compensation for those who may find themselves at higher risk because of their specific job duties. Another example would be correction officers. Another example would be frontline clerks who still have to go to a window and accept some public document from the public in order to keep business open. And so it's really fairly limited. Obviously, all of those employees on telecommuting won't be eligible. But it's, again, these employees who find themselves in a unique position where they cannot social distance because of their expected job performance. And that's the limit of it.
Mr. Chairman.
Mr. Christie.
Could I hear some comments from the sheriff regarding this?
Sheriff Napier.
Mr. Chairman, members of the board, thank you. As Mr. Huckleberry points out, I made the proposal to him on April the 1st for special assignment pay, which is permitted under county policy to recognize employees that are under unique hazards. So this is not a new thing. We already do this for SWAT operators and motor officers that have unique hazards. It is quite clear that a deputy about to effect arrest cannot ask somebody to take their temperature or don PPE equipment or otherwise social distance themselves. They're under unique hazards. The same applies to my corrections staff who are in pods with 60 inmates and cannot always don protective equipment or engage in social distancing. So they're under very unique hazards. And as Mr. Huckleberry correctly points out, this is not an extension to all employees, but a select group of employees that because of the COVID-19 crisis are facing very unique hazards. I became a law enforcement officer more than 3 decades ago. I always accepted the fact that I could be shot in the line of duty and I could lose my life. I did not accept the fact that that bullet could come home and harm my family. And that's what our deputies and our corrections officers are facing right now is a hazard that's invisible. I think many of them, as I pointed out earlier, are standing tall. They're doing their duty. They're accepting the new threat. But this is now a threat that can migrate to their homes and affect their family, affect their children, affect their elderly parents, because it's an unseen enemy. And so I would ask the board to approve Mr. Huckleberry's recommendation. It is consistent with county policy that already exists, and it recognizes those select employees that are essential that cannot, at no fault of theirs, don protective equipment or engage in social distancing because of the very things that this county expects them to do to maintain public safety. So I implore this body to accept the recommendation in recognition that these employees that every day face challenge and danger on behalf of service to this county are now facing unique danger, unique threat that they cannot otherwise take the precautions that all of us are able to do. So I would ask that you approve the recommendation by Mr. Huckleberry. Thank you.
Mr. Chairman?
Supervisor
Just one
Miller.
more comment. The grocery store clerks, the people at the medical offices, doctors, nurses, are they getting hazard pay?
Some of them are.
Some, but not all. The grocery store clerks aren't.
Mr. Huckleberry.
Yeah, Mr. Chairman and Supervisor Miller, we can provide who we actually surveyed on this, but we did find that some of the grocery store stockers and clerks were actually receiving the $2 an hour.
Supervisor Miller.
I would just, caution again that there are people who are out there working and are put in these same situations that are not getting hazard pay, and that in the current situation where we have forced people out of work by making the decisions that we've made, that this is sending a message that we care about our own, but we're going to take care of our own. And I think that's a bad message to send right now, because I don't know about the rest of you, but I'm getting concerned about social unrest. The people that are out there that are getting desperate. And this is just, something that I think that isn't sending a good message.
Any other discussion? If not, hearing no further discussion, the vote will be on addendum item number 1, the premium COVID-19 premium pay and COVID-19 furlough. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay.
No.
By your vote of 4-1, motion carries. I believe the next item would be the rent deferral. Mr. Huckleberry.
Yes, Mr. Chairman and members of the board, this is, we have 38 different organizations, from nonprofits to businesses to startups, that are located in county facilities, who pay lease rent to the county. Some actually pay as well utilities and operating and maintenance expenses. What I'm proposing is that the county defer the collection of those rents, utilities, and operating and maintenance expenses for the next 6 months, and make it as flexible as possible to those particular users or those who pay rent to us, such that start and end date can be, appropriately crafted to their needs. There are going to be some who may not want it or may not need it. There'll be others who will need both. Lease rent deferral. And I think it's important to stress this is not forgiveness, this is deferral. At the end of the period, we would then negotiate a repayment plan with the particular user, such that they would repay us with interest, and they can either repay us a lump sum at the end of the 6 months, or they can basically enter into a payment plan. And that payment plan can be crafted to their unique circumstances, but they would pay an interest rate of 2.77% on the unpaid balance.
Thank you.
Questions? Discussion?
I'll make a motion to approve the 6-month rent, utility, and operating and maintenance costs delay for Pima County's leased properties as recommended by staff.
Second? Discussion?
Mr. Chairman?
Supervisor Miller.
Again, many of these individuals who are leasing these properties have already received favorable treatment that the private sector does not get. 2 examples: Accelerate got below market lease rates when they first came in here. Worldview, we all know the situation with that. And there's $2 trillion available from the federal government for all of these types of businesses, including nonprofits. What makes these individuals any different from the rest of the private sector? What gives them a priority over the private sector? This smacks of favoritism and special interests who have gotten favorable treatment in many cases already, as I said earlier, and we're now going to tell the taxpayers that we're going to use county funds and defer that. We already do a lot of deferrals and payments for things like leasehold improvements, that kind of thing. And we're going to do this now when this community's really hurting and everyone else is getting in line and going to the federal government, all these various grants, and there's a lot of them, small business loans, unemployment assistance, pandemic emergency unemployment compensation, recovery rebates for individuals and families, community health centers, emergency sick leave, emergency relief and taxpayer protections, $450 million towards businesses, states, municipalities, including counties, to cover any losses. I don't want to be the one, and maybe the rest of you do, and you feel real comfortable with this, who delivers this message to the community. When the community hears about this, they're going to be outraged. It's going to set off a firestorm. People are already frustrated because their businesses are closed. And if we do this, I think that it's sending, again, a very bad message. It's $2.5 million, and I don't think we're thinking ahead. Our state shared revenues are going to be way down. We're going to get hit very hard. And the PAYGO program, in my opinion, I agree with the individuals who wrote the letter from the city at this point. It's a tax increase. We all know it's a tax increase, and that's going to hit us as well. Are we going to vote to approve that at this point? And next year, I am sure the property valuations are not going to be what they are today. So I am very concerned about this. I think it sends, again, a very bad message, and I think it's singling out individuals for preferential treatment. Thank you.
Mr. Huckleberry?
Mr. Chairman, it's, in our view, again, it's a potential deferral of a maximum of something like $2.8 million for 6 months. If you remove operating maintenance and utilities, it's down to about 1.8. And then I think what you need to understand is that, again, this is not forgiveness, this is deferral, and this is a small step the county can provide to nonprofits that are basically affiliated in some cases with all the public services that we do, or startups that are actively employing people. And I think, you know, my position and point has been I'd much rather have those businesses or nonprofits pay their employees as opposed to pay the county rent. I can do without the rent for 6 months, and it's not going to financially hurt the county.
I was going to have Mr. Huckleberry, just to make it abundantly clear, are we forgiving anything here?
Mr. Chairman, this is not forgiveness. This is simply deferral. And again, it's at the option, because there may be some of these businesses who choose not to take this opportunity. But I think they all need to be treated equally.
Supervisor Miller.
Mr. Chairman, there are mechanisms in this $2 trillion federal government package that allows people to apply for that type of assistance. And they have to meet certain criteria. I understand that, but so does the private sector. Are we providing any monies to defer the rents due on private sector businesses? I don't think we are. And these individuals here in the county-owned facilities can go through that same process that the private sector is.
Mr. Huckleberry?
Yes, Mr. Chairman, again, as I said, this is unique to the county, and it is things that we can do. And I think the difficulty is, and that's why I think we've chosen 6 months, because as you've seen, the nightmare to try and get small business assistance, you know, it may be a month or two before that comes. So I think, yes, the folks who are either nonprofits, they have that opportunity, but it may take them 2 to 3 months or even 6 months to get through that process.
As it will for the private sector. I guess I just
Supervisor Miller.
Thank you.
Supervisor Villegas.
Chairman Valdez, will there be safeguards in the contract to make sure that They're aware that it's got to be paid back, of course, and that also the main purpose is for them to keep as many employees on staff as possible. Some of them have already laid off employees, I'm sure, or furloughed them. And also, will we make sure that, or does it matter if they're double dipping? So if they do apply for funds from the $2 trillion, will they also be able to apply to go through this, and would that be considered double dipping? I'm not really sure.
Mr. Elgary.
Yes, Mr. Chairman and Supervisor Villegas, a couple of things. I think the issue is they're all eligible to do this. The moment they get eligible, I would assume they would pay us back, because I don't think they want to pay the interest. And so they each will then have an individual contract that talks about their obligations to continue and make those payments once they're able to do so. And I think the issue is once we basically talked about, I would rather have them pay their employees than pay me rent. Is I think that if we try and I think that'll be the goal stated in this document, but I think also some of them, and I think part of the point is we know some of them are already furloughed employees, and what we don't want them to do is furlough more employees.
Right. Thank you.
Supervisor Christie?
Is there any kind of issue, though, to Supervisor Villegas' point that if the company that's involved in this takes advantage of this county forbearance, and then on the next breath they go in and receive funding from the government, is there any kind of wording that says it's either or? If you do get government funding through the trillion, then you do not become any more eligible for the forbearance and must pay any credits that you've received thus far?
Mr. Chairman and Supervisor Christie, I think the contract that we'll enter into will talk about if they receive funds for this purpose from a federal, they will immediately continue to pay us.
And that will be in the contract?
That'll be in the contract.
And roughly off the top of your head, I'm sure maybe it's here in the materials, all these businesses, what is the total amount of employees?
Mr. Chairman, Supervisor Christie, I don't know. I would assume that knowing the ones that are in there, it's probably 1,200 employees or maybe more.
And I've noticed also, Mr. Chairman, that the list of the potential businesses that would be the recipients of this are, a number of them are, I noticed Baggins and a couple of bars in the vicinity. Is that the kind of the mix?
Mr. Chairman and Supervisor Christie, coffee shops, I don't think we have any bars. We do have sandwich shops, which you reference Baggins. And so, yes, it's those types.
And I would only add to further a little bit on what Mr. Huckleberry was talking about. A guy by the name of Albert Einstein one time said about interest and compound, or rather interest. He said, "Those who understand interest earn it; those that don't pay it." So to illustrate the point that I don't think that if they can afford to pay it, they're going to want to do this simply because they're not going to want to pay the interest. All right, I believe we have a motion on the floor. It's to approve the 6-month rent, utility, and operating and maintenance cost delay for Pima County's leased properties. If there's no further discussion, we'll take the vote. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. No. Ayes have it by 4-1. Mr. Huckleberry, or Mr. Supervisor Christie, I believe our next item is the one you have a conflict on.
And Mr. Chairman, before we go to that item, just something for Dr. Garcia. We received a letter from Dr. Michelle Manos regarding our reporting of confirmed cases. And she was asking for the information to be reported at more granular local levels, community level data. Is that something we could do?
Dr. Garcia.
Chairman Valadez, Supervisor Bronson, we are restricted in terms of the amount of potentially identifying detail that we can reveal through any of our methods, whether it's a map, whether it's a report, and that is restricted by federal privacy law,
Okay.
and that's restricted by state. However, we do understand that there is a need to better represent these data in ways that are more easily consumed at the local level. So we're exploring a variety of actual mapping kinds of representations so that we can come up with better ways of communicating that information in ways that are meaningful to the community, but still protect the privacy of the individual and those institutions.
Thank you.
And Dr. Garcia, I believe Dr. Englund also addressed the issue that because of the lack of larger scale sampling, there may be an issue with really how useful that information is. Is that correct?
Correct, Chairman Valadez. The limitation will be that unlike if we were testing everybody, that data would be super interesting and super relevant and actionable. Because we are only testing a small fraction of very high-risk people, that data may be potentially less useful.
Yeah, the robust beauty of improper linear models.
Mm-hmm.
Can I
Yeah, whatever she said. Supervisor Villegas.
Yeah, I just wanted to add to that. I also got a letter, a couple of letters actually, in regards to testing and starting with our own employees. You know, some employees feel vulnerable when they go into their building and see that others are not taking the care that they're taking. And actually came up with a recommendation that possibly we could find enough tests to actually test a whole department within the county of essential employees that are still in the building to see, because we really don't have any idea as to whether there's a problem or not, right? I mean, really, if we're not testing. So, yeah, I'm putting that out there that an employee asked, and it was an employee that felt vulnerable. And then also, I would like to, for the next meeting, talk about our vulnerable populations and what we really are doing to protect them, and what we're doing to make sure that there's not some racial disparities going on, although we know there probably are. And I think that it's important when I don't understand why we can't get more geographic data. And the reason I say that is because when I talked to my family in San Diego, and I actually went on their website, they break it down all the way to zip code as to how many positive cases there are. And when I talk to my family, that's really a deterrent for them to go out, you know, when they know that it's in their neighborhood. And I think that if they can do it in California, why wouldn't we be able to at least get more geographic information here in Arizona?
I'm going to go Mr. Huckleberry and then Dr. Garcia.
Yes, Mr. Chairman, members of the board. The issue of reporting is really both federal and state health controlled and regulated. In the federal law, it's HIPAA, and the state, it basically conforms with that. There is a litigation already from Yuma County with regard to displaying and giving that information to first responders, fire, and police. That case has been decided by a Superior Court judge. We're unaware of whether the state is going to appeal that decision. Pinell County has filed a similar lawsuit, or not Pinell. It was advertised as Pinell, but it was one member of the board in Pinell who has actually now withdrawn his complaint, and so, but it's for, I think it was Apache Junction and another community that's pending, and that talks about displaying it on the, I think, zip code level. And I think our legal counsel's reviewed that particular case, and it's unlikely to succeed. I think the danger in doing all of this is that you basically, and particularly for first responders, is that I think our advice has always been that you assume that whoever you're dealing with is infected. If we then begin to give them information about who is infected, does that give them a false sense of security that then will then allow them to lower their guard when they shouldn't? And so that's one of our bigger concerns. We are working with our GIS folks and everyone else to display the data in a manner in which it cannot identify any particular person who may be infected. We have not gotten to the level that we're confident that that can occur, but we're continuing to work on it. And I think until we, get more direction from either the state health department or the courts, our position pretty much remains the same, as that data remains protected.
Supervisor Villegas?
Yeah.
Okay. Anyone else?
And Mr. Chairman, one of the issues I think, and again, it goes to the point of testing, whole groups, and I think the tests are there's so lack of testing that, again, those tests are prioritized for healthcare providers or for healthcare providers that are exhibiting symptoms so that they can be, properly taken care of and, removed out of the system if, in fact, they are infected. So there's where all the priority tests are occurring. The thing that we can do, and what this board has already approved, is this wellness checks that we're doing, and you went through one this morning.
Yes.
And what it says is that every morning when you come in, you're going to have your temperature taken, and if you have anything that's unnormal, you're going to be handed a card that says, here's where you go to see your health care provider, and you won't be allowed in the workplace. So that's kind of providing some sense of, say, security to the balance of employees who are required to be here, that at least there's that check occurring every day.
And I think that's really important.
Anyone else? All right. If not, sorry, Supervisor Christie, thank you for coming back. Please let the record reflect that Supervisor Christie has stepped off the dais, and we're on to number 18. I believe, Mr. Huckleberry, we have a memo in front of you. Would you like to cover it?
Yes, Mr. Chairman. Again, what we, as said in the memo, I think the last sentence says we've been very inartful as to how we describe this. And, if a sheriff's deputy wrecks a car that is under warranty and we got to replace the engine, well, guess what? We got to buy a new one. So that's what it is.
And I want to commend Supervisor Miller for asking that question because it was inartful.
Thank you for the clarification.
Chair would entertain a motion to approve the item.
So moved. Okay. No.
I'm sorry. I thought I turned it off.
All right. Is there a second? Second. This motion is on the approval of item number 8 on the regular agenda. All those in favor, please signify by saying aye. Aye. All opposed, please signify by saying nay. Let the record reflect a 4-0 vote, and that Supervisor Christie abstained from the vote. Having no further business in front of this board, without objection, this meeting stands adjourned.